Good day, everyone. I welcome you to today's lecture. And my name is Akinshu Johnson Adewale, the e-tutor for this course, HA 302, Pharmacodynamics and Chemotherapy 2. Yes, this is the first time of our meeting, of our contact. And in the last 5 study section, my colleagues have been able to handle some of the topics which I believe that you well comprehend. So, without wasting much of our time, we'll continue from where my colleagues have stopped, and I'll begin with you with study section 6, which deals with focuses on cardiovascular agents. And I want to believe that you all understand what we mean by cardiovascular and some of the agents have been treated with you in study section 5. That's to do with cardiovascular agent 1. So we'll continue from there. So, and uh, these are our learning outcomes for this study section. That by the end of this study section, you as learners should be able to, one, discuss anticoagulants, antiplatelet, and thrombolytic drugs. Two, describe beta adrenergic blocking drugs with their examples. Three, discuss calcium channel blocks, their examples and mechanisms of action. Four, highlight and discuss the centrally acting drugs. And lastly, we'll be looking at some of the cholesterol lowering agents. So, and by way of introduction, cardiovascular drugs encompasses a large number of prescription medications that are used to control heart disease. It's a complicated group of drugs, with many being used for multiple heart conditions. So, what that simply means is that the drugs we'll be looking at will be drugs that are usually being prescribed to take care or to control heart disease. And you all agree with me that most of the drugs under this under consideration are group of drugs that are so complicated, used for multiple heart conditions. So, in the previous study section, you have been introduced to cardiovascular drugs. So, in this study, you will be introduced to other classification of cardiovascular. And to start with, these drugs are sometimes referred to as blood thinner, but this term is not truly accurate. They inhibit the ability of the blood to clot, preventing clot from forming in blood vessels and, form, and from getting bigger. So, under a number of different circumstances, it becomes necessary to stop clotting. So, anticoagulants, antiplatelet agents, and thrombolytics each have specific indications and uses. So, this set of drugs they make the blood lighter and they never allow the blood to go clot or to clot. And if there should be any clot, they have the tendency of lysing the clot, so the coagulation. Any patient who has had a heart valve replaced with a mechanical valve requires long life oral anticoagulants in order to prevent clot from forming. And what that simply means that patients that have had a heart valve replacement, they have the tendency or they can come down with what? Uh, 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 Coagulations, that is clotting of the blood, which may uh, block the blood flow. So, and this set of people, they need a long oral anticoagulant in order to prevent clot from forming in the valve. So, patients who develop atrial fibrillation may require anticoagulant. Clot formation in the left atrium is a potential hazard of these rhythmic disturbance. So still on anticoagulant, antiplatelet, and thrombolytics, oral anticoagulants are prescribed for patients who develop thrombophlebitis, an inflammation of the vein in the legs or pelvis. So that's another uses of anticoagulant. So one of the dangers of this condition is the development of blood clot that may travel to the lungs and cause pulmonary embolism. So anybody that has a thrombophlebitis, that is inflammation of the veins in the legs or the pelvis, they have the tendencies what developing blood clot, and this may eventually travel to the lungs. And when that happens, pulmonary emboli. That is, there will be blockage to the all the blood vessels in the pulmonary bed. So, lastly, some patients who have a serious heart attack involving the front surface of the heart are prescribed an anticoagulant to prevent clot from forming on the inner lining of the scar. Now, the most recent and existing class of drugs that are useful for people with heart attacks are the thrombolytic drugs. These agents are given intravenously as soon as possible with the goal of dissolving the offending clot within a coronary artery. Patients having a heart attack can be helped considerably if the clot can be dissolved before it causes a permanent debilitating damage. So, and want to begin to look at some of the examples of anticoagulants, antiplatelet, and thrombolytics. And the first one, the generic name of the first one is acetylsalicylic acid, which is otherwise known as what? Aspirin. So, and these are the names of the producer in the, what do you call it? The producer and the brand names in the bracket in front of the generic names. So, aspirin is being supplied in tablet. You can have it in 1 milligram form, 325 milligram form, 650 milligram form. So we equally have capsule of it, which is 325 milligram, 650 milligram. And this can equally be found in suppository, supplied in suppository, and it comes in form of a dosage of a 325 milligram, 650 milligram. So, and to describe these drugs, it is a non-narcotic analgesic and antiplatelet used since 1899. You can see that the drugs are being used for a long period of time and is still in use till date. So it's still effective, except that there are some other contraindications and complications. I mean, what do you call it? Adverse effect when it is used for a long time. So, and the effect of these drugs is that it helps prevent blood clots. Also, it treats pain, fever, arthritis, colds, menstrual cramps, headaches, and joint and muscular aches. And these are the positive side effects. Indigestion is the most common side effect. And the dosage to inhibit clotting. This can be given at rate of 81 milligram to 325 milligram per day. And presently, you discover that this group, one of the examples that is common is dispirin, fesoprin. All these things, they contain aspirin at 75 milligram uh, by single dose. So, note, aspirin can cause Reye's syndrome, a rare brain and liver disorders that usually occurs in children. So, when you are talking of Reye's syndrome, you know, uh, Reye's syndrome is commonly occur in children. So, aspirin may increase the effect of other anticoagulant drugs. So, that means when you take aspirin alongside with other anticoagulants, so aspirin has the tendency of what? Increasing the effect of these other anticoagulant drugs. So then another anticoagulant is dipyridamole, that is pacitine. So, and this is being supplied in tablet, uh, in dosage form of 25 milligram, 50 milligram, 75 milligram. So is an antiplatelet and anti-angina drug, first introduced in the late 1970s. The effect of this dipyridamole is that it helps keep blood clots from forming in people who have just had an heart attack, heart surgery, a stroke, or a heart valve replacement, usually given with aspirin or warfarin. Then, the possible side effect of these drugs is adverse effects are rare, but may include nausea, headache, flushing, dizziness, faintness, or rash. And the dosage is 75 milligram to 400 milligram per day. Note that paracetamol may increase the effect of other anticoagulants, just like that. That's just like aspirin. Now, another example is generically. Another example is a warfarin. So, and the generic, I mean, the trade name is Coumadin or Warfarin. So, and it is being supplied in tablet form, and we have 1 milligram of it, 2 milligram of it, 2.5 milligram of it, 5 milligram, 7.5 milligram, and as well as 10 milligram. The description of warfarin. Warfarin is prototype oral anticoagulant. It has uh, some drugs related to it, and it have been used for nearly 50 years. The effect, it prevents blood clots, especially in the legs and pelvic veins, where blood flow is at its lowest. Also, it is used in people with atrial fibrillation or after a heart valve replacement. So, possible side effect of the warfarin is that excessive bleeding is the most common adverse effect. Nausea or vomiting, loss of appetite, abdominal pain or diarrhea, rash or bruising, and ear loss are also possible. Dosage 50 milligram on the first day of treatment, then 10 milligram on the second day, and 2.5 milligram to 7.5 milligram day thereafter. So note, interaction with a variety of drugs. Interact with a variety of drugs. Check with your physician and the pharmacist to get to know some of the other drugs that they interact with. So, and now we want to move to another group of drugs or categories of drugs for cardiovascular disorder. And we have beta adrenergic blocking drugs that are simply called beta blockers. So these drugs probably reduce blood pressure by reducing the output of blood from the heart, or perhaps by blocking the production of angiotensin. They were first introduced in the United States in the 1960s to treat angina and to lower blood pressure. Specifically, they block responses from the beta nerve receptors. This has to slow down the heart rate and to lower blood pressure. So this is the mode of action of this. So blockers also block the effect of some of the hormones that regulate blood pressure. During exercise or emotional stress, adrenaline and norepinephrine are released and normally stimulate the beta receptors, sensors that transmit messages to the heart to speed up and pump harder. By blocking the receptor, beta blockers act to reduce heart muscle oxygen demand during physical activity or exertion, thus reducing the possibility of angina caused by oxygen deprivation. So, beta blockers may be prescribed as the initial drug to lower blood pressure, or they may be given along with diuretics or other antihypertensives. So, this drug can be combined with other drugs, can be taken alongside with other drugs, diuretics and other antihypertensive drugs. So, still in under beta blockers, in general, beta blockers are more effective in younger patients because they relieve angina. They may be the drugs of choice of people who have this problem, along with high blood pressure. Beta blockers also damp heart rate. Heart rate increases caused by stress, exercise, or anxiety. stage performance occasionally. Take them to combat the heart palpitation, voice cracking, or fine tremors of the hands that may be associated with stage fright. Now, I want to look at some of the examples of beta blockers. And under this, the generic name is acebut- acebutolol, acebutolol, and the trade name is Sectra. Then we have atenolol, and the trade name is Tenomine. Then we have metoprolol, and the trade name is low pressure. Then nadolol, and the trade name is Cogad. Then we have pindolol, and the trade name is Fiskin, and propanolol, which is one of the commonest one, is Indira. This one has equally been in existence for some time. Now, this drug is being supplied in capsule in the following form. Acebutolol is being supplied in capsule. And we have 200 milligrams and 400 milligram dose form. Then we have atenolol tablets at 50 milligram and in 100 milligram. Then we have the injection of atenolol 0.5 milligram per mil, 10 per mil per ampoule. Then we have metoprolol tablet 50 milligram and in 100 milligram. Then we have the injection of metoprolol 1 milligram per mil, 5 milligram per mil. Uh, then we have a nadolol tablet 20 milligram in form of 20 milligram, 40 milligram, 80 milligram, 120 milligram, 160 milligram. Then pindolol tablet 5 milligram and 10 milligram. We have propranolol tablet 10 milligram, 20 milligram, 40 milligram, 60 milligram, 80 milligram, 90 milligram, and then we have the sustained release capsule of propranolol, which is in form of 60 milligram, 80 milligram, 120 milligram, 160 milligram. Now, let's look at some of the description of this group of drugs, that is the beta blockers. The first one are still on the first examples. Example number one, we have acebutolol, atenolol, and metoprolol are cardioselective, acting mainly on the heart, opposed to both heart and lungs. These drugs mentioned above, that is acebutolol, atenolol, and metoprolol, are cardioselective. Simply means that it acts mainly on the heart as opposed to both heart and lungs. So, beta blockers that were first introduced in 1985, 1981, and 1978, respectively. So, nadolol was introduced in 1980. Pindolol is one of the newest beta blockers. Then propranolol was introduced in 1968 and was the first beta blockers to be available in the United States. Then the effect of these drugs, that they treat tension, angina, some abnormal heart rhythms, palpitations, and tremors caused by overactivities of the thyroid glands and anxiety such as stage fright. They protect the heart from further damage after a heart attack. They may help prevent migraine, headaches. Then the positive effects are lethargy and cold hands and feet because of reduced circulation and feet because of reduced circulation may occur. So also they may cause nausea, nightmares, or vivid dreams and impotence. So take note of that. They may also precipitate asthmatic. Still on the beta adrenergic blocking drugs, that is beta blocker, the dosage of acetabolol is 200 milligrams to 600 milligrams per day. Atenolol is 20 to 25 milligrams to 100 milligrams per day. Metoprolol 50 milligrams to 150 milligrams per day. Nadolol 40 milligrams to 160 milligrams per day. Indolol 10 milligrams to 40 milligrams per day. While propranolol is 40 milligrams to 240 milligrams per day. Note, none of the beta blockers should be used by asthmatic or people with chronic lung disease. So you need to take note of this. That when you have somebody that is that requires beta blockers, you need to screen the patient for asthma. Are they asthmatic? Are they people with chronic lung disease? The moment you are able to confirm this, that the patient is asthmatic or they have chronic lung disease, you abstain from it. You don't use kind of group of drugs. So beta blockers should be used with caution. Insulin dependent diabetes and people with peripheral vascular. Yes, this is another important information that we need when it comes to the use of beta blockers, because we have to be cautious. Patients who are insulin dependent and insulin dependent diabetics and people with peripheral vascular diseases. So then, still under the note of this, okay, we want to move to another group of drugs or categories of drugs for the heart. We'll be looking at calcium channel blockers. Calcium channels blockers. From this, we will all understand what this simply means. In the heart, there's always uh, uh, what do you call it? During the contractility of the heart, there used to be uh, ions and anions, uh, ions released from the heart. This is talking about electrical stimulation of the heart. So all these elements are very, very important. So and the moment these channels are being blocked, it has specific effect on the heart. So let's look at the explanation. So calcium plays a central role in the electrical stimulation of the cardiac cells and in the mechanical contraction of the smooth muscles cells in the walls of arteries. Calcium channel blockers are relatively new synthetic drugs that work by blocking the passage of calcium into the muscles that control the size of blood vessels. All muscles need calcium in order to constrict. Take note of that. That's one of the importance of the calcium. So all muscles need calcium in order to constrict. By preventing the muscles of the arteries from constricting, blood vessels open up, this they dilate, allow blood to flow through them more easily. Blood pressure is then the blood pressure will be reduced when this happens in the body. So calcium channel blockers are effective in initial treatment of high blood pressure in about 30 to 40% of patients with hypertension. They may be added to a diuretics or other antihypertensive medication. So some of these drugs, calcium channel blockers, are added to some of the antihypertensive medications or drugs. So they are generally well tolerated even by people with asthma, but they are more costly than diuretics or beta blockers. Thus, many doctors still recommend that other be tried first. So I want to look at some of the examples of calcium channel blockers. And the first one is uh, dialtia- dialtiazem, that is cardicem. So, and it's being supplied in tablets, in capsule form. So the tablet form, we have 30 milligram, 60 milligram, 90 milligram, and 120 milligram. Then the other one, which is capsule, is sustained release capsule. We have 60 milligram, 90 milligram, and 120 milligram. So let's look at the description. It's a calcium channel blocker and anti-angina drugs introduced in 1984. And the effect, it reduces the frequency of angina attack and lowers blood pressure. The positive side effects are headaches, nausea, tiredness, ankle swelling, dizziness, and rash can occur. Dosage is 60 milligram to 240 milligram. Then another example is uh, nicardipine, that is cadine, or nifedipine, that is procardia and procardia XL. Then these are being supplied in this form. Nicardipine is supplied in capsule form, in dosage form of 20 milligram and 30 milligram. Nifedipine capsule in forms of 10 milligram and 20 milligram. Extended release tablet of Ivermectin, Ivermectin, extended release tablet of Ivermectin, dosage form of 30 milligram, 60 milligram, and 90 milligram. So, nicadi- nicardipine is one of the most recently introduced calcium channel blockers. Nicardipine is a calcium channel blocker and anti-angina and anti-hypertensive drugs introduced in 1962. Now, the effect of these drugs is that they help relieve angina pain and prevent attacks, reduce blood pressure, and they help improve circulation in the limbs. And the following are the possible side effects. They may cause redness of face and neck, headache, palpitations, dizziness, nausea, low blood pressure, ankle swelling, and rash. And the dosage form is nicardipine, 60 milligram to 120 milligram per day, nicardipine, 30 milligram to 120 milligram. And still on calcium channel blockers. Another example of these drugs, group of drugs is verapamil, and these are the trade names: Calan, Isotretinoin, and Veralan. Then this drug is being supplied in tablet form in those form of 40 milligram, 80 milligram, and 120 milligram. Then we have sustained release tablet form, which are supplied in form of 180 milligram and 40 milligram. Then we have capsule form, in those form of 120 milligram, 240 milligram. Then we have sustained release caplets, sustained release caplet in form of 180 milligram, 240 milligram. Then we have the injection of these drugs in form of 5 milligram per mil and 10 milligram per mil ampoules. Then 5 milligram per 2 mil and 10 milligram per 4 mil vials. Then it is a calcium channel blocker, angina drugs, and antiarrhythmic drugs introduced in 1901. That's the description. Then this effect of these drugs in the body is that it suppresses some arrhythmias, help prevent angina attacks, and reduces high blood pressure. Possible side effects are excessively slow heart rate, low blood pressure, headache, swelling of feet, and constipation may occur. So, and the dosage is 120 milligram to 360 milligram per day. So, the next group of drugs we'll be looking at is centrally acting drugs. Drugs in this category act on the brain centers to reduce nerve impulses that constrict blood vessels. Vessels open up, that is, they dilate. They may also cause the heart to beat more slowly. This group of drugs, they cause what we call vasodilation, that is, they open up what? The blood vessel. And and when this happens, it will reduces uh, the blood pressure. And not only that, they may also cause heart to beat more slowly. When that happens, the heart will conserve energy and reduce the rate of oxygen consumption. So, and this will equally indirectly may even reduce the angina. So, centrally active drugs are not widely used in initial treatment of high blood pressure. So, take note of that centrally active drugs are not widely used in initial treatment of high blood pressure. Instead, they are given along with diuretics, other antihypertensive drugs when these drugs alone when these drugs alone do not produce an adequate reduction in blood pressure. Still on centrally acting drugs, examples of centrally acting drugs are central alpha adrenergic agents, and the names are clonidine, and the trade names for clonidines are catapres TTS, guanibens, that is watizine, then guanifacine, NX. So, and these are supplied in tablet form, clonidine tablet, in those form of 0.1 milligram, 0.2 milligram, 0.3 milligram, then 7-day transdermal patch. It can also be supply in patch, dermal patch. So, and this can be used for 7 days, like 0.1 milligram per day, 0.2 milligram per day, 0.3 milligram per day. And then guanibase tablet, 4 milligram, then 8 milligram. Guanifacin tablet, 1 milligram. So the description is that these are antihypertensive that reduce the stimulator nerve impulses from the brain to the heart. Then the effect is that they lower blood pressure. And the possible side effect of these centrally acting drugs are drowsiness or sedation, constipation, dry mouth, headache, dizziness, weakness, rash, depression, ankle swelling, cold hands, and impotence may occur. And the dosage is that choline is 0.1 milligram to 1 milligram per day. Vanillin is 4 milligram to 24 milligram per day, divided dose into two. Then guanfacine, 1 milligram to 3 milligram per day. So we need to of some of take note of some of this important information that cloning also may minimize withdrawal symptoms during smoking cessation or alcohol detoxification and may relieve hot flashes that occur during menopause. Still on centrally acting drugs, we are still on the example. Another example is metidopa, Adomen. I think this is one of the commonest centrally acting drugs, which is majorly used for uh, antihypertensive, hypertensive in nature. So they are being supplied in tablet form of 125 milligram, 250 milligram, and 500 milligram. Then it can be supplied in suspension, 50 milligram per ml, in a 473 mils bottle. Now, the description, it was introduced in the 1960s and it's still a widely used antihypertensive. It's still being used now. So the effect that it lowers blood pressure. And possible side effect is that dizziness or lightheadedness, drowsiness, headache, dry mouth or stuffy nose, swelling of ankles or feet, tiredness or weakness, fever, depression, and liver inflammation may occur. And the dosage is at 250 milligram to 1000 milligram per day in divided dose into two. Then, note, methyldopa may be suitable for treating high blood pressure in women during late pregnancy. Take note of that. Very, very important. So, methyldopa may be suitable for treating high blood pressure in women during late pregnancy. Now, I want to look at the last aspect of today's study section, with this with cholesterol lowering agent. Cholesterol lowering agent. To determine whether drug treatment for a blood cholesterol problem is necessary or not, the level of blood cholesterol must be measured. What that statement simply means that before you will ever think of administering this group of drugs as a cholesterol lowering agent, you need to first determine the level of blood cholesterol. So there's need for one to measure this, carry out this investigation for cholesterol lowering agent what are prescribed. So if it is over 200 milligram per DL, the doctor may wish to repeat for confirmation and perform additional measurement of the level of high dependent lipoprotein and low dependent lipoprotein cholesterol. That is the good and bad component, and triglycerides, that is blood fat. So what that statement simply means that if the result or the outcome of the blood level of cholesterol turn out to be over 200 milligram per DL, so there may be need for, or the physician may require for the repeat of the test to further confirm, and to be able to know the types of or the level of the kinds or the types of cholesterol we have. And we have high dependent lipoprotein and low dependent lipoprotein. Low density, high density lipoprotein and low density lipoprotein cholesterol. So that is the good and the bad component and triglyceride, that is blood fat. So in general, drug therapy is prescribed to reduce elevated level of cholesterol or other blood fat only after several months of dietary modification alone have failed to do job adequately. So remember, cholesterol lowering medication is considered an adjunct to dietary modification, not a replacement for it. So you have to remember this, and it's very, very important that cholesterol lowering medication considered as considered an adjunct to dietary modification, not a replacement for it. So if a person on drug therapy for high blood cholesterol continues to eat a high fat, high cholesterol diet, the effect of the medication may be undermined or undone. Once drug therapy for elevated blood cholesterol is begun, the therapy may have to be continued indefinitely. So this is why the decision to begin cholesterol lowering agent therapy call for careful consideration. We want to begin to look at some of the examples of cholesterol lowering agent. Number one is cholesterol, that is the trade names are cholesterol light. Then another one is cholesterol, this cholesterol. And it's been these drugs are being supplied uh, in powder, that especially the uh, cholesterol powder. So and the carton of 60 uh, six, a carton of 60 uh, 9 gram packet uh, or can of 375 gram gram. So then we have cholesterol granules and a box of 30 of 5 milligram packets. Then bottle of 500 milligram, 500 milligram, 500 gram rather, 500 grams. Sorry, 500 grams. Then these drugs called description. These drugs called bile acid sequestra sequestrants work in the intestine work in the intestine to bind bile acid, which are then excreted. This stimulates the liver to remove more low density lipoprotein cholesterol from the blood in order to manufacture more bile acid. So the medication are in powder form and must be taken mixed with water or some other liquid such as orange juice. They are available in packets or in bulk with a scoop equal to one packet. The effect of the cholesterol, I mean, these are the first example of cholestyramine and cholesterol. Total cholesterol may be reduced 10 to 20% to an average regimen. However, these drugs do not reduce triglycerides and, in fact, may raise them in some people. The possible side effects are constipations, bloating, heartburns, nausea, vomiting, headaches, and interference with absorption of other drugs may occur. Many people are unable to tolerate dosages high enough to produce the desired effect. And the dosage is 2 to 4 packets or scoops twice daily. Most effective when taken with meals. Note, may interfere with absorption of several drugs, including thiazide, diuretics, digoxin, wolverine, beta blockers, thyroid medications, and antibiotics. Patients taking any of these drugs may be advised to take them 1 hour before or several hours after a dose of bile acid sequestrant. To reduce the possibility of constipation, increase intake of fluid and dietary fiber. If constipation still occurs, ask the physician about taking a psyllium-based stool softener or other laxative. With a long record of safety and effectiveness, drugs are listed among the first choices for cholesterol-lowering therapy. In inconveniences include the gritty powder form of the medication and the common side effect of constipation and other gastrointestinal disorders. So still on cholesterol lowering agent. So another example is a gemfibrozil, that is lopid, and this is being supplied in capsule form of 600 milligram. Description: this drug, which belongs to a class of agent known as fibric acid, works by breaking down a component of blood cholesterol called very low density lipoprotein, very low density VLDL, and the effect is that gemfibrozil is prescribed to lower elevated level of blood triglycerides and to increase uh, high density lipoprotein. However, the drugs may also cause a moderate reduction in low density lipoprotein cholesterol. So the positive side effects are muscle aches or weakness, abdominal pain or discomfort, diarrhea, and nausea may occur. Dosage: 600 milligram twice daily, most effective when taken 30 minutes before morning or evening. Note: gemfibrozil may increase the effect of warfarin and other anticoagulant drugs. If you take an anticoagulant drug, your physician may need to readjust the dosage. So you need to take note of this. It's very, very important. So it offers convenience and relative lack of side effects. However, increases chances of developing gallstones or liver dysfunction. So another drug in this class is fenofibrate, that is lipidil, may soon be available in the United States. I think by now the drug must have been available in the market. So another example of cholesterol lowering agent is lovastatin, that is mefacol. That's the trade name, and this is supplied in tablet form and in form of 20 milligram and 40 milligram. The drug to restrict the liver's production of cholesterol by inhibiting the action of enzyme called HMB-CoA reductase. As the liver synthesize less cholesterol, absorb more low density lipoprotein, that is bad cholesterol, from the bloodstream. So effect: it may lower low density lipoprotein cholesterol by 30 to 40%. At higher doses, it may moderately decrease triglyceride and increase high density lipoprotein cholesterol. Possible side effect: we have headaches, rash, muscle ache and weakness, dizziness, lightheadedness, cataract, and liver function abnormality may occur. And the dosage is 20 milligram to 80 milligram. So note, lovastatin causes relatively few side effects in most people. However, as a newer drug, it has a shorter track record of safety than some other agents. It is possible that lovastatin may cause liver dysfunction or cataract. For this reason, liver function test every 6 to 8 months. An annual eye examination may be recommended for people taking this drug. Take note of this; it's very, very important. So other drugs in the category of HMGCOA reductase inhibitors that may become available in the future include simvastatin, that is Socor, pravastatin, that is Pravacor, and fluvastatin, that is Locor, pending Food and Drug Administration approval of for prescription use. So another example under this category of drugs is Probucol, that is the trade name is Lorecor, and this is being supplied in tablet form, 250 milligram, 500 milligram. And the description on this: Probucol works in the bloodstreams, alter the makeup of high to alter the makeup of low density lipoprotein cholesterol, and causing it to be removed more quickly from the blood. And the effect is lowers total and low density lipoprotein cholesterol, but it also may lower beneficial high density lipoprotein cholesterol. So it will inhibit the oxidation of lower density lipoprotein cholesterol, thus help keep it from being deposited in artery walls. The possible side effect of these drugs is that there may be indigestion, diarrhea, headache, rash, and insomnia. Insomnia may occur. The dosage is 500 milligram twice daily. So, and with this, we have come to the end of today's study section lecture. And I want to believe that we've all learned one or two things. And for the sake of exam, I want you to take note of some of the action, that is the effect of some of these drugs, their dosage, and sometimes there's possibility of asking you about the generic name or the trade names. So all these things are very, very important. So in essence, in conclusion or in summary, we've been able to look at the categories of cardiovascular uh, agents, and among these groups are the anticoagulant, antiplatelet, and thrombolytic drugs. Secondly, we look at beta adrenergic blocking drugs with their examples, and likewise we look at the calcium channel blockers with their examples and their mechanisms of action. Then we have been able to highlight and discuss the centrally acting drugs, and finally we discussed about cholesterol lowering agents. Thanks uh, for listening. So I wish you uh, success. Thank you.